Welcome back to the Daily Apple. Our next story deals with a problem that plagues many older adults, sleep deprivation. The Institute of Medicine reported that an estimated 50 to 70 million Americans suffer from chronic sleep disorders, and this is having a devastating impact on people's health. Obviously, in certain situations, sleepiness can have catastrophic consequences, such as driving or working in dangerous situations. But in general, being sleep deprived creates many other physiological and mental disorders. For too long, these have not been addressed by public health officials. Let's take a look at how some people are contending with this problem and striving to find the best ways to alleviate situations that lead to sleep disorders.
I would just wake up in the middle of the night with my legs shaking.
Sometimes I would fall asleep and then wake up maybe 40 minutes later and I'm up.
Walter Bank and Barbara Freed are just two of an estimated 50 to 70 million Americans who suffer from disorders of sleep and wakefulness. According to the Institute of Medicine of the National Academies, these disorders can have serious, long-term health consequences.
The same instructions.
The same instructions. Open and close your eyes and look from side to side, and then we'll get the nap started.
Okay. Sleep is a critical part of all of our lives. There are many functions to sleep, and we don't do well without it. And sleep disorders are very prevalent throughout all ages and increase in frequency as we get older.
The American Association of Retired Persons reports that more than 50% of people over age 64 have some form of sleep condition. Nevertheless, says AARP, it's a mistake to think that our need for sleep declines as we get older. Rather, there are often identifiable reasons why senior sleep gets interrupted. Changes in the body's internal cycles, chronic pain brought on by conditions such as arthritis, heartburn or heart disease, depression, stress, and more.
We do accumulate all sorts of problems as we age. Whether or not that's related to other drugs and other medical conditions, that could be the case in some people. Other individuals, it just happens to be the luck of the draw.
There are roughly 1,000 sleep centers in the United States today. Not enough, according to the Institute of Medicine of the National Academies, to treat the sleep disorders that afflict our population. The Center for Sleep and Wake Disorders in Chevy Chase, Maryland, is headed by Dr. Helene M. Selim. It's equipped to give patients a thorough sleep evaluation. Electrodes and bands are placed on specific regions of the head and body so that the research team can monitor brainwave activity, eye movement, heart rate, and abnormal movements of the arms and legs. The goal is to pinpoint the cause of interrupted sleep.
The main causes of sleep disorders include insomnia, which may cover the whole spectrum from just not being able to wind down at the end of the day and relax and initiate sleep, to people who have trouble staying asleep or fall asleep fine and wake up too early in the morning. Other problems that can occur and interfere with sleep include breathing disorders such as obstructive sleep apnea. There's also restless leg syndrome and the nocturnal component of that disorder called periodic limb movements of sleep.
Walter Bank first noticed he had restless leg syndrome, or RLS, nearly 60 years ago. At the time, so little was known about the disorder that there wasn't even a clinical name for it. About 8 years ago, Walter noticed the shakes were getting worse and had spread throughout his body.
This got so bad that as my wife and I were sleeping, I would suddenly get one of these fits and my arms would flail out, and I hit her several times, and finally she said, I'm going to move out because until this is under control, I don't want to get bashed in the head. So she did. She moved to bed in another room.
Shortly after, Walter read a newspaper article about RLS.
I think that's what I've got. And so I went to my doctor and described it, and he said, why don't you go and check it out?
Barbara Freed has been visiting Dr. M. Selim's center for the past 6 years to treat her insomnia. But the real source of her problem in sleeping was only diagnosed recently.
We decided that the problem was resistant enough to medication to warrant doing an overnight sleep study. And a sleep study was obtained, and we found, rather surprisingly, that she has a significant amount of obstructive sleep apnea.
I've had stress in my life, as everyone does. If stress caused it, I would have started longer than 10 years ago.
According to the Institute of Medicine of the National Academies, sleep loss and sleep disorders have been associated over the long term with an increased risk of hypertension, diabetes, obesity, depression, heart attack, and stroke. In addition, Dr. Emselem says difficulty in sleeping may be a warning sign of a health problem that has not yet emerged.
Someone might experience a disturbance in their sleep as an early sign of dementia. They might experience a disturbance in sleep as an early sign of a depression. These problems with sleep may occur later in other disease processes as well. So there's a whole spectrum of problems, and a sleep problem should be taken seriously and considered in the context of the patient's entire physical and mental well-being.
Doctors may use a number of different means to treat sleep disorders, including medication behavioral therapy and assistive devices. Barbara Freed uses a device known as a continuous positive air pressure machine to overcome her sleep apnea.
When I go to bed at night, I have to fill a little machine with water. I then connect up the hose to it and then connect it up to my nostrils. It blows air into my nostrils and opens up my throat so that I'm breathing better than I normally have been.
For Walter Banks' restless leg syndrome, medication seems to be the answer.
This can happen. Right now, it's pretty well under control. I get plenty of sleep.
Experts are just beginning to understand the full spectrum of sleep disorders and their effects, but the importance of getting enough sleep seems clear. If you're having consistent trouble getting the sleep you need, it may be time to talk to your doctor.
Here with us today is Dr. David Neubauer, Associate Director of the Johns Hopkins Sleep Disorder Center. Dr. Neubauer has worked in the field of psychiatry and sleep medicine for more than 20 years and has written extensively about a wide range of mental health topics, with a focus on sleep, depression, anxiety, psychosis, and the treatment of psychiatric illness. Welcome. Thank you for being here at the Daily Apple.
Thanks so much. I'm very pleased to be with you.
How many hours do we need to sleep a night?
Well, you know, it's a difficult question that we're often asked. The best way to answer that is you need as much sleep at nighttime as it takes to function well during the daytime. We think of sleep and wakefulness as being really two sides of the same coin. Now, we often hear the number 8 hours, which is a pretty good thing to aim for, but not everyone's able to achieve that much. Some people get by on much less and feel great in the daytime. Some people sleep 8 hours or a little bit more and still feel kind of sleepy and fatigued during the daytime. And so those are the clues that tell us that there's something else going on that might need to be investigated.
But it's individual. Let's say you're a busy executive or you're a busy retired person. Right. Can you train yourself to sleep less hours?
No, you can't. People think and hope and wish that they could. Many people feel that sleep is a waste because they think about all the other things they could be doing, whether it's in the work environment or leisure or hobbies as well, and think, well, I have to go to bed now. But actually, sleep is really important. I think in our culture we tend not to value it enough because we're ready to do all sorts of other things, spend the time that we should be sleeping watching television, you know, maybe doing things on the internet. I think one of the, you know, in one sense, great inventions, but really one of the worst for sleep has been the remote control, because we remember the days when to change the channel, you had to get up and walk across the room to do that, and now, of course, you just have this little button, and I think that keeps people awake longer at night. People of all ages are so much more likely now to end their evenings watching television, and while, you know, there's a great role for television, certainly it can intrude on the time that people really should be sleeping.
Talking about that, I heard that one of the things that you should make sure you do is not have a television or a computer in your room.
I think it's probably pretty good advice for most people. You know, people who sleep fine can probably do that okay, but those people who are having a lot of trouble falling asleep may find that they're just doing those things right up until the very moment that they want to turn out the lights and fall asleep, and usually that doesn't work so well. We strongly advocate that people develop a relaxing routine in the evening that eases them into sleep rather than being so active right up until that last moment, because it's hard to instantly wind down and fall asleep quickly.
You were talking a little bit about the cultural differences. So like in Mexico, they have siestas. And if you sleep during the day, for instance, or different patterns, is that better or worse for you?
Well, it's not necessarily better or worse, but certainly sleeping in the daytime may be less convenient. Many of those, quote, siesta cultures are moving away from that because of the business environment. And so those opportunities don't exist as much as they used to. We think that most people need roughly 8 hours out of a 24-hour period. If you sleep for an hour or two during the daytime and sleep somewhat less at nighttime, maybe that's going to work out okay. And so we're not rigid saying that you have to have all your sleep at nighttime, but for the most part, our circadian clocks, the regulation of the sleep-wake cycle, really optimize our sleep to occur best at nighttime.
Can you more clearly define circadian clocks for us?
Well, we all have a very profound rhythm in our bodies, a 24-hour rhythm. We pretty much take for granted the fact that we become sleepy around our bedtime and typically go to sleep at about the same time. We don't just sleep at nighttime because it's dark, it's quiet, there's nothing else to do, and I might as well do my sleeping then. Rather, it is controlled by various physiological rhythms. There is the circadian rhythm, circa dia, so about a day, and it's a whole orchestration of different rhythms within our bodies, and the sleep-wake cycle is probably the most obvious part of that. And this is really, in a sense, tuned to the day-night cycle, to the photoperiod. And all of this biology has really been very well worked out, how light enters our eyes, goes through the retinas, and then back to the suprachiasmatic nucleus, which is a very, very tiny part of the brain where this 24-hour timekeeper exists.
So you were talking a little bit about wives' tales earlier, and we've always heard that seniors have insomnia and they stay up, but are you insinuating that's more individual? It's not about your age?
It is very individual. There's no question that there is a general tendency as we get older for our sleep to deteriorate somewhat. However, large-scale studies, the National Institute on Aging, for instance, has evaluated many, many thousands of people in large-scale surveys and have found that bad sleep is really not an expected consequence of aging, but rather those people who tend to have the worst sleep have it in association with other problems, other medical, perhaps psychiatric disorders. Maybe they're on lots of other medications or have changes in their lives that may lead to further deterioration in their sleep.
I can see how lack of sleep can be related to fatigue during the day or lack of alertness, but what about dementia, memory, depression? How does it affect those things?
Well, there's a lot of overlap. There's no question that when people are not getting enough sleep or satisfactory quality of sleep, then they have consequences in the daytime. We'll see some people who come in saying that they're sleeping all night long, and yet still during the daytime they're having a lot of fatigue. They may be falling asleep when they don't mean to. They may not be functioning very well. They may be complaining of their memory being very bad. That may be totally due to very bad quality sleep. Now, in the filmed segment, we saw someone with obstructive sleep apnea, and it's very possible for just that disorder alone to cause those symptoms in the daytime. Now, when people actually have dementia, that certainly can interfere with sleep, but sometimes just the sleep apnea and other disorders that undermine sleep present with similar symptoms of some degree of depression, lack of motivation, and some memory difficulty as well.
Quickly before we go to break, can you explain for us lay people what REM sleep is?
Well, since sleep began to be studied with electronic equipment, with polysomnographic equipment like an EEG, it was possible to look at different brainwave activities. And some people think of the sleep as the time that our brain is turned off, and it's really not true at all. Our sleep is a really fascinating landscape of different electrical activity in the brain. Clearly, there are different stages of sleep that become evident when looking at these kind of recordings, and about 20% or so of our sleep is what we call REM sleep, which is rapid eye movement sleep. It's called that because when we're in that stage of sleep, our eyes tend to move back and forth. The rest of the night is in non-REM sleep, and that gets divided into different stages, 1, 2, 3, and 4, depending upon how deep that sleep is, all determined by the different electrical activity that we see on the EEG tracing.
Very interesting. Hold that thought. We're going to be right back with you. We need to take another break. Don't go away, because we'll be back shortly to continue our conversation with Dr. David Neubauer about sleep deprivation and how to alleviate this problem in our own lives.
Do you know? What segment of the population is most susceptible to nightmares? Do you know? What segment of the population is most susceptible to nightmares? The answer is A, young children. Children ages 3 to 8 are more likely to have nightmares than other people.
We're back to continue our conversation with Dr. David Neubauer of the Johns Hopkins Sleep Disorder Center. Dr. Neubauer, we always hear about seniors waking up very, very early. Is that just something that we do when we're retired, or is it something that's indicative of being a mature adult?
Well, actually, there's a sort of a developmental trend that people follow. Young children sleep a long period of time, and then around adolescence, there is this delay in the clock, this tendency for them to stay up later and sleep later. And then as we move into adulthood, we shift back a little bit earlier. And then as we move further along in years, there's a greater tendency for our whole internal clock to shift earlier. And so a lot of older individuals find that they become sleepier and naturally are able to fall asleep at an earlier hour compared to when they were younger. But corresponding to that, they also have a greater tendency of awakening earlier as well. Now, that may be welcome, perhaps a greater opportunity to get up and read the paper and get the day going, maybe get some exercise first thing in the day. On the other hand, some people find that it's so early that it is annoying to them. It may still be dark out. Everybody else in the house may be asleep still, and they may be complaining to their doctors about this insomnia problem. Now, it may be a big problem for them. It may be that they're waking up so early that they're not able to get enough sleep for the total night, and therefore might feel fatigued and sleepy during the daytime. It might be a symptom of depression. And so there are a lot of things to think about, but nevertheless, there's still this general tendency as we age for this clock to shift somewhat earlier.
As we age, also, mature adults are taking more prescription medicine. Are medications, do medications have an impact on your sleep as well?
Well, sure, there's no question about it, and there's so much polypharmacy that there's an even greater opportunity for there to be the sorts of interactions that may play a role with sleep.
What do you explain polypharmacy for?
Well, people taking many different medications, which and therefore is greater chance of other interactions between them.
You, in one of the articles that I read that you wrote, you talked about the night owl pattern. Can you explain that for us?
It really has to do with our circadian clock and the tendency for this rhythm to either be advanced or delayed. So those people who are advanced are those people like the early birds who naturally are waking up at an early time. And those people who are delayed or who in a severe situation would have what we would call a delayed sleep phase syndrome are those people who are unable to fall asleep for a very long period of time.
What about sleepwalking? What is that?
Well, there's a general category that's called parasomnias, and these are different behaviors that emanate from sleep. You asked earlier about REM sleep and non-REM sleep, and we tend to divide the parasomnias into these two different categories. And so those people who have non-REM parasomnias tend to do things that are somewhat earlier during the night when we have most of our deepest sleep. Sleepwalking would be an example. We see some people who get up and eat during the night and may not remember that they're doing it. People may have sleep terrors where they will sit up and scream, terrorizing everybody else, but not remembering that the next day.
Really?
But the parasomnias that we categorize as REM-related are really more relevant to an older population. You know, normally when we're asleep, our muscles are pretty much relaxed. But when we go into REM sleep, our brains are active as if we're actually doing all the things that we're dreaming about while we're in REM sleep. And fortunately, there's a cutoff mechanism that's in our brainstem that prevents all of those signals from being transmitted to our muscles. That's a really good thing because it allows us to remain asleep. But for some people who have a disorder called REM sleep behavior disorder, this mechanism is not working correctly. And therefore, when people are having very vivid and sometimes violent dreams, the signal is actually being transmitted to their muscles. So while they're in bed, they may actually be thrashing about and risk injury for themselves or other people with them, spouses in particular.
Yeah, no kidding. What is a dream? I mean, how does a dream come into being while you're sleeping?
Well, that's a great question that really hasn't been solved at this point. We know a tremendous amount about different brain activity that's occurring during dreaming, but exactly how it's generated really is not completely understood. However, our brains during REM sleep, when we're dreaming, are as active as when we are awake. So that's why I say that sleep is really a very interesting landscape that has a lot of different changes throughout the night. But what's interesting with this REM behavior disorder is that people in their sleep while they're dreaming may actually fall out of bed because of that. I've seen patients who have broken bones. I've seen those who have injured spouses in bed with them. And then when they wake up, they're able to vividly remember what it is that they were dreaming about. This one gentleman who was kicking his wife talked about how these 3 dogs were biting at his legs, and this was a very vivid experience for him, and unfortunately he was actually able to move his muscles and therefore cause that kind of problem.
So dreaming obviously has effect on sleep disorders as well. What about snoring? What is that?
Well, everybody can imagine the sound of snoring. We know that that even what would seem to be relatively benign snoring may have long-term health consequences. It certainly may be an indicator of sleep apnea. And we know very clearly that sleep apnea is a relatively common problem and causes poor quality sleep because of many arousals that occur. And all of that can lead to excessive sleepiness during the daytime.
Now, if I'm a person that doesn't sleep well, what's some of the advice that you give me in terms of being able to get a better night's sleep?
Well, we do a very broad evaluation of the patients who come in to see us, and so we've already seen that there are such a multitude of factors that may contribute to complaints either of not being able to sleep, so that would be insomnia, or in the daytime not being able to remain awake, which would be hypersomnia, too much sleepiness, excessive sleepiness. And so in this evaluation, we may determine that there are other related conditions for which treatment of those may be optimized. It may be that we see that there are psychological or psychiatric issues for some individuals. Sometimes it's the sleep environment that's very important. And so we think about sleep hygiene recommendations that might be customized for patients. The sorts of things that relate to keeping a regular schedule and having a comfortable evening routine, being careful about alcohol in the evening. Many people try alcohol thinking medicinally that it's going to be a cure for their insomnia, but it usually backfires, because while people may initially become a little bit sleepier with it, usually later during the night there's more what we describe as a hyperarousal, greater likelihood of waking up during the night.
Is there a genetic relationship to lack of sleep?
Well, there's certainly, in particular conditions, some genetic relationships. Overall, there probably is not, but there certainly are some particular conditions where there is some clustering in families.
And is sleep apnea actually treatable? Can you get rid of it completely?
There are a few different factors that will contribute to sleep apnea. Weight is a major issue. Now, we do see skinny young women, skinny older women as well, who have bad sleep apnea, and obviously losing weight's not going to be feasible for them, but many other sleep apnea patients are overweight, and sometimes weight loss can make a very big difference for them. However, as we saw in the film, the CPAP, the continuous positive airway pressure, is usually the primary treatment that we turn to, and that can have very beneficial effects over a long-term basis, but it's not curing the problem. It's something that you need to stay with.
Before we close, what are some alternative medicines, some Eastern medicine, aromatherapies, things like that that are helpful for sleep?
The NIH recently put together a state of the science panel to look at the problem of chronic insomnia, and they reviewed all of the literature looking at treatments of all kinds, including cognitive behavioral therapy, the complementary and alternative approaches, over-the-counter approaches, prescription medications as well. Actually, there really is not good evidence right now of any of the complementary and alternative approaches. There are many things that are marketed for sleep, and individual patients or consumers may find some benefit, but really overall, there are no large-scale studies that really allow us to make particular recommendations for those.
Thank you so much. This is great information.
Thank you.